So welcome to February, everybody, and welcome to Facebook Friday. Those of you who join us regularly know that every week we hop into our Facebook private discussion group and then later via YouTube to give a bit of an update about what's been happening in the world of nets, answer some frequently asked questions, and sometimes also to give a bit of an update about other health issues that affect people with nets. So before I continue, I'd just like to pay my acknowledgement to the traditional owners of the land that I am broadcasting to you from, which is the land of the Wurundjeri people of the Kulin Nation, and just want to take this time to acknowledge elders past, present and emerging. One of the things I love to do here where I live on Wurundjeri country is I love to go running along the Yarra River, which in the Wadawurrung language is called the Birrarung. So I'm very grateful for that, and today in Melbourne it is really, actually I can see little bits of blue sky out my window, but it has been quite stormy and rainy across, I think it was like this last week, so we're definitely in that damp summer kind of weather period. I actually feel like I'm in Sydney because it's quite humid and rainy. Anyway, moving on. I did want to give a brief update about COVID. I know we don't talk about this every week, but this week there's been quite a bit of news, especially if you live in Melbourne or you live in Perth, with some positive cases of the UK variant of the virus, which indeed does seem to be highly infectious. Great news at the moment is that it looks like we've got a good handle on transmission in the community with those cases. So I know everyone's been collectively holding their breath, hoping that we don't need to, in Melbourne, that we don't need to go back into lockdown, and certainly I know those in Perth have been, and the southern region of Perth have been very much looking forward to being able to go outside where it's really hot and not to be wearing a mask. You know, just our thoughts to you all. I think you know, when there's cases of COVID in the community and there starts to be restrictions, it does have an impact for people with cancer. And you know, all of those questions around, well, how important is my scan, how important is my blood test, am I getting weird messages from my going to telehealth, and also being able to take a carer or a support person with you to appointments can also be really affected. So just thinking of you all, as always, I'm here. If you're having trouble navigating things, or if it's you know, impacting on any aspect of your care, then just notes. I also just wanted to let you know, I just attended, sorry about the shuffling of papers, but I've just got offline from a government briefing about the COVID vaccines that are very much in the planning stages in Australia. It was an hour long, so I'm obviously not going to give you the full detail of what was discussed there, but just a few key points of note that I thought you might be interested in me passing on, and as soon as there's more information, as you know, I will get it to you as quickly as I can. It seems that the consistent message that I'm getting, although it's not, they haven't articulated be in the category of 1B. So that's like the second phase of the rollout amongst many phases. For people in this situation, there were lots of questions asked about timeframes, and we're not really, the government, you know, the short answer is they're not really able to give a definite plan as to what date people will start to be able to access the vaccines. But the Pfizer vaccine has been approved by the Therapeutic Goods Alliance, and we're anticipating delivery of that vaccine in Australia in late February. So, and then the AstraZeneca vaccine, which is the other one that's sort of more imminent, they're looking at early March. That's one still under TGA consideration, so we're expecting that it will be implemented, but you know, that's a little bit later, not very much later, but a little bit later. So what they're thinking is, based on the current information, I think it's probably fairly likely that people with cancer would be offered the Pfizer vaccine but it may be that the AstraZeneca one is the one that you're offered. And I think the consistent health advice from all of the experts is you take the vaccine that you can get. In Australia, more broadly, the vaccine will be made available through GP and pharmacy clinics. Immunisation clinics came up as to whether people will, whether there'll be immunisation clinics for COVID-19. That's under state by state jurisdiction, so there will be some individual variations depending on what state you're living in, but they are expecting that the nurse-led immunisation clinics where you get all of the immunisations, they're expecting that they will be jabs in arms, so they're going to be wanting to enable as many people as possible to get those vaccinations as soon as they possibly can. They emphasise www.health.gov.au, so I'll make sure that website's in the notes as well. There were lots of questions from the people who were part of this briefing about all of the fine lines with this, so that they've got some broad categories. So we know that 1B, it says younger adults with a chronic illness that might mean that they would get more sick with COVID. It doesn't actually mention older adults or middle-aged adults, and I did ask what the age cutoff was going to be, and they didn't answer that question. They had hundreds of questions, so I didn't get to that one. But as I said, as soon as I know more, I'll let you know. My anticipation would be actually that older people with cancer would be more probably highly prioritised than younger, but younger people, even so, are in stage 1B. Interesting point that I didn't know before I went to this briefing was that there's a requirement that there will be at least 14 days between a COVID vaccine and the flu vaccine, which obviously they're going to be really, I know they pushed that very heavily in 2020, and the rates of flu were very, very low in the community in 2020, probably because of all of the lockdowns, but they'll be strongly encouraging the flu vaccine again in 2021. But we'll just need to bear that in mind, that there needs to be a couple of weeks in between. So what else can I tell you? The best indication I could get about timeframes was that it would be a couple of months to get through stage 1A, which is all of the, the quarantine workers and the people who work, the healthcare professionals who work on COVID wards, those people, and very elderly people. 1B, so it's a rough guess, but maybe we're thinking maybe early May. So it's a watch this space, of course, but that's my best. That's the best information I've got. And I guess the other thing that I would say to you is that we continue to try and find an expert to come in and do a Facebook Friday about COVID and vaccines, because we know this is a very important issue that you're very interested in. We'll keep trying. I had one person who said they'd come, but they weren't happy to put it on YouTube. And I think actually this is an issue that's really of great importance for the entire net community, not just people on Facebook. So we'll persevere to see if we can find an expert who's willing to, broadcast, via YouTube as well as Facebook. So we'll, watch this space. We'll get to that as soon as we can. So today I wanted to have a talk about sleep. This is a topic that comes up, frequently in our Facebook, in our patient communities. People often talk to me on the Net Nurse line about sleep and the quality of their sleep and how their sleep's being affected by their cancer. It's not uncommon for me to come in the morning, open up my computer, and there'll be a post from someone in the middle of the night saying, "Good morning, hello, is anyone up? I can't sleep." We know it's an issue for people, and so we thought this week we would take a bit of a dive into that. And there's information about it, but actually there's also lots of tips and strategies which I'm really keen to share with you. So let's go. The first thing, as I always say, this is very general information. You can go to university and study to be a sleep specialist, so this is just really the tip of the iceberg when it comes to sleep. And everybody's different. Everybody's management of their cancer is going to be different. So for your own situation, please do talk with your healthcare team. I guess really from the get-go, the most important thing is this: if this is an area of your life that you are struggling with, it's really important. Don't just put up with having really dodgy sleep and not talking to your health professional about it. And if you're not really getting much joy from your health professional, maybe ask for a referral to talk to someone who knows more about it, because this is something that we know makes a huge difference to quality of life. You know, there's no such thing as a one-size-fits-all solution, but we know that for a lot of people we can actually get this working better for you. So we're keen for you to get the help that you need. Watching a video is a good start. I'll be putting heaps of resources in the notes about other things that you can access online and through other resources, but also really important to know that, you know, if symptoms please, if symptoms talk to your healthcare team about it, or give me a ring, have a chat on the phone with me about it. So why is sleep important? You know, it's something actually I think ideally we're barely aware of it. You know, if it's working well in our lives, we don't even think when we get out of bed whether we had a good is that you do. But we know that's not always the case, and particularly when cancer's on the scene, we know that's frequently not the case. So sleep's important, well, A, because if you wake up after a rubbish sleep, you feel like, you know, awful, and you hate everybody, and, you know, it just affects every other aspect of that day. So it can be such a feeling of, oh, when you get up in the morning after a rotten night of sleeping. So we know just from a quality of life perspective, it's really, you know, crucial. We also know that a lot of healing in the body takes place when you're sleeping. So, you know, they've done, and all of these studies are pretty much on rats and mice, because it's not very ethical to keep humans who are not very well awake artificially. We want you to sleep as much as we can. So the research is often done on our poor little rat and mice cousins. But we know that when we deprive rats and mice of sleep, they don't heal as well. We know that when we sleep, our body's really busy reducing and sorting out and getting rid of toxins out of our system. It's also really important for your brain to have the downtime so it can kind of do its sorting out. Now, I remember, I think this all happens in my computer without me knowing about it these days, but I remember, you know, 20 years ago, my husband used to get to my computer and he'd call it defragging, where it would sort of sort through and make sure all of the files were tidily lined up in their little boxes, and that there were no spaces being occupied by duplicate files, and that, you know, so that it sort of maximized the function of the computer. It's a bit like sort of shutting down our computer and then rebooting it. Sometimes that can make everything work better. So sleep's a bit of a way of rebooting our brains. But it's also, and so I guess if you're not sleeping well, you might have more difficulty with things like cancer brain or chemo brain or short-term memory issues. It also seems to have some impact on our immunity. And again, this is just in rats and mice. We don't deprive people of sleep and measure how fast their cancer grows or their cancer shrinks. So we don't have any definitive evidence about this in people. But look, even if it's just for a quality of life aspect on its own, we want you to be sleeping well. You know, there are some suggestions that there are better cancer outcomes in those little tiny animals when they're sleeping well too. So what are some of the issues that can affect our sleep? You know, apart from the occasional random bad night's sleep that most of us will have, you know, from time to time, well, what is it that, you know, what are some of the things that can happen? Think of insomnia, they might think of having trouble going to sleep in the evening, and that's often certainly an issue. But you can also have insomnia in the middle of the night. So, you know, waking up at 2 o'clock in the morning, maybe you need to go to the toilet and having trouble going back to sleep and just lying there in the dark. It can actually be so lonely when it's the middle of the night like that, when you despite going to bed at normal time, you might just wake up really, really early in the morning and just, you're lying there listening to the birds waking up and just thinking, Buckley's chance of getting, going back to sleep. Might as well get up and have an early breakfast. We can also have hypersomnia, so that's less commonly kind of talked about, but it's certainly an issue that people do have, and that can be, it's often, sleeping too much, or what we perceive as sleeping too much. So, just not being able to keep your eyes awake during the day. And that can be really very much a symptom for people when cancer is advancing, when the body's working really hard to manage the side effects of treatment, and lots of tumours, so your liver might not be working so well. So your body's having to work a lot harder to, do things like process those toxins and reboot your brain and all that sort of stuff. So you can have hypersomnia where you just, feel like you're sleeping all the time. The other thing that can happen a lot with people with cancer, especially when we drag you into hospital, is that you can get a real disruption in your sleep-wake cycle. So, a lot of people find that they need to have a nap during the day, but that might mean that they then have trouble sleeping overnight. It might be that you've been in hospital for some time and you've been, hospital timetables have really got a long way to go in terms of being patient-friendly. There's the doctor's rounds at 6 o'clock in the morning sometimes. There's the fabulous domestic staff who are, rattling around with their trolleys of fresh water, and there's the nurses, with their trolleys taking everyone's blood pressures at 6 o'clock in the morning often. There's the cleaning that happens to get started very early in the morning. Joke and or squeaking shoes on lino corridors, and sometimes you get hypersensitive to it, so every little noise just makes you wake up. The PA announcements, the buzzers, all of that stuff can really affect you in hospital, and that can really muck things up when you get home and trying to get back into what's your normal sleep-wake cycle. As we get older, there are things that really affect the quality of our sleep. So I just wanted to give a nod to some of those things, because we're all getting older and lots of people with cancer are in this older category. So we might notice these things sort of deteriorating just because we're actually getting, we have the privilege of advancing in age. Certainly we know that generally people who are getting older don't sleep as well. There used to be like a false perception, I guess, that older people didn't need as much sleep, but actually we've realised more recently that older people, it's not that you need less sleep, it's just that you're getting less sleep, and so the impact of not sleeping well, it gets bigger and bigger the older you get. Isn't that encouraging about getting older? Like, seriously. But the other thing that happens in as you get older is the hormonal aspects, so especially for women going through menopause. Now, if you're going through cancer treatment, that can bring about a really abrupt menopause much earlier, and I did do a video on nets and hormones, so I did mention this in that video. I'll make sure there's a link to that in the notes. But, things like hot flushes, but also, and I'll talk a bit more about cancer and nets and hot flushes as well, but they can, there's nothing more, I'm sure there are more things more disruptive than having to throw the sheets off and on again, but it's pretty annoying. Speaking from some personal experience, when you're waking up and you're too hot, you're too cold, you're sweating, just the... the other thing that can happen as we get older is the tissues in our throats and our nasal passages tend to get a little bit more floppy, and we also often put on a few kilograms. Sometimes that's related to our hormones as well, but those things increase our risk of sleep apnea. Apnea just means the absence of breathing, so it's big gaps in between breaths. Now, it's actually normal to have gaps in between breaths, so you might breathe, and you probably notice if you've got a partner, or you've had a partner in the past, you might have noticed, there'll be a breath, breath, and then a bit of a gap, and you're thinking, oh, is this all right? It is often fine, but sometimes if those gaps are getting big, longer, we can have dips in the blood oxygen level, and that can be a problem. Now, because it's stormy and weird in Melbourne, the weather plays havoc with my internet, so my video feed has disappeared. Last time this happened, everyone could still see me, so that was good. So maybe just, if you're watching on Facebook, I know there were a few people watching, just send me a little, yep, I can still hear you, that'd be grand. I'll cross my fingers and I'm going to keep going. I guess a lot of things happen when we're going through a cancer diagnosis or cancer treatment, or we're living with cancer, on top of the normal things that happen as we get older, and the normal ups and downs of life that mean that we can have interruptions to our sleep. Fantastic. Thank you to the person who's just said we can still see you. So that's beautiful. Thank you. So I guess the first thing that we think of is that it's actually really normal to feel very worried when you're going through a cancer experience. And we know that mood has a huge impact on sleep. There's nothing worse than not being able to go to sleep because you're feeling worried. And sometimes it's that, the days are particularly busy, and they often are, when you're going through something like this. Sometimes it's not till the lights go off and the telly turns off and the phone turns off and people stop talking at you, that it's a chance for you to start thinking and processing mentally and emotionally all of the things that are going on for you. And sometimes it is a time in the day where the worries and concerns can really plague you. Sometimes when worries are like that, it can be a little bit of a sign, a bit of a hint to you that maybe we need to bump up the amount of support that you're getting in the daytime to help offload some of that burden, so you're not getting it visit you quite so frequently overnight. So I guess that's the thing. If you're finding you're lying awake worrying, or you're having trouble going to sleep because you're worrying, so it's maybe a cue that talking to a counsellor, talking to a psychologist, talking to a support nurse can be really helpful, and just bumping up that emotional support. I've talked about depression in a past video, so I'm going to, sorry, these things get very linky, but I will be posting a link to that video as well, because it's really important as part of this that we look after your emotions and your mental aspect of living with cancer. One of the other things that can have a huge impact is pain. So again, during the day, often we're busy, and you might be rushing around, and sometimes moving can actually help pain. You're distracted often. There's other things happening. There's people visiting. You've got visits and things like that. But sometimes it's when you're lying in bed trying to sort of have some restful still time that the pain can really emerge in your awareness and really nag at you and make you have trouble sleeping. We know, and I mentioned this earlier with fatigue, is that when you're going through cancer, your body's having to work really hard. It's growing tumours, unfortunately, and we often don't get to really choose that, but growing a tumour is like growing a baby. So your body unfortunately is investing some energy in these tumour cells replicating and making new tumour cells, and that makes you tired. Cancer treatment can make you very tired. Pain medication can make you very tired, so your need for sleep can increase over what would have been normally. The other thing with that is that you can find that you need to take a nap during the day, and it can be hard to limit that or work out where the balance point is, because fatigue fluctuates from day to day, and one day a 2-hour nap might not really impact on your night's sleep, but another day a 2-hour nap might mean that you're lying awake not really feeling very sleepy at the normal bedtime, so that's tricky. In NETs, our hormones can play a huge role, and this is really unique to people, or fairly unique to people with NETs. There are certainly other cancers where there's a hormonal aspect, but NETs, it depends on what sort of NET you've got. Some hormones out. Some of the examples are, if you're producing too much serotonin, you might have diarrhea overnight, and that's going to be a massive interruption to your sleep. Sometimes people when they're having these hormonal outputs, it can mean that they actually have trouble with continence. So I talked about this in a really much earlier episode, but gosh, if you have to get up and change your clothes or change your sheets, that can be hugely disruptive to you and those you're living with. I was talking to a lady just the other day about, she's having to get up a lot of times overnight to wee, but she gets quite a lot of pain when she walks, and so when she's walking to the toilet, she's continent, she's not having trouble wetting the bed, but the process of walking to the toilet really flares her pain up, and then when she gets back to bed, it takes her quite a long time to go back to sleep, and then she's having to get up multiple times in the night. So we'll talk about some of the strategies there. But just briefly, even just having a little commode by the bed, you can actually hire them from pharmacies and disability supply places. Can take a bit of getting your head around, learning to wee if you've got a partner in the room or something, but sometimes it's worth the investment just to, make that process a bit less disruptive for you. It's a bit more tricky with bowels, but if it's urine, then you can, a commode can be really useful. Flushing is the other thing that can happen with too much serotonin in your system. Some of our other more rare tumours, so pheochromocytomas, can mean that you get too much adrenaline, or you can get massive fluctuations in your blood pressure and have dizziness and those sorts of issues. So that can really play havoc with your sleep. We know that people who have carcinoid syndrome are more likely to have a vitamin B3 deficiency. That can lead to itchy skin. And I know a lot of people with cancer have itch. It can be a side effect of some drugs too, and the peripheral neuropathy that can come from a vitamin B3 deficiency, but also again as a side effect of some of the treatments that we give you. Even if it's not pain, having those niggly, discomfortable things that you can kind of maybe distract yourself and put up with during the day, but at night time when it's all gone quiet, those symptoms can be very loud. The other thing that can happen, and I talked about sleep apnea before in terms of a normal response to aging, but some of our paraganglioma patients might have tumours in your carotid body or in your neck area. That can mean that breathing is more challenging, and so again, if you're having trouble breathing, and sometimes it can be very, very worrying trying to go to sleep, and so that can really play havoc with it as well. The other thing that a lot of people with cancer are on medications, and so there's lots of medications that can really affect your sleep, and I guess a prime example of that is steroids. So a lot of people who are having chemotherapy, or sometimes if you've got a tumour that's very swollen, they will give you a medication called dexamethasone. Sometimes if you've got lung constriction, we'll give you some prednisolone. These steroid medications can really ramp up hype up your body, and it can mean that you feel more anxious, and it can mean that you feel more wakeful. So if that's an issue and you're on steroid medications, have a talk to your treatment team about whether you can sort of sort the timing out. Often we can actually do this so that you have the first dose of steroid really early, in the morning, and the next dose, before lunch, and then you've got like a little bit more time over the afternoon where that might be wearing off a little bit, and that might mean that you can sleep more easily. It's not always appropriate, so do talk with your health professional about that. I'm just looking at my notes to make sure that I've covered all the bases, and I can still see some comments here to say that people can hear me. So I'll cross my fingers. I guess the comments will stop if I drop out, and then we'll just work out what to do after that. So there are some things that we know, regardless of what the sleep issues are being caused by, really help. And we bundle those together in a term called sleep hygiene. And I'm going to make sure that there's lots of links to some resources in the notes, because I don't expect you to remember all of the things that I'll tell you about. But I'm going to just briefly go over them, because it might mean that a few things stick in your brain. The first thing is, there's 2 points initially that sometimes it's like, do these 2 points really dance well together? And I think the jury's out. The first thing is to try and go to bed and wake up at a similar time each day. So to sort of schedule, for example, you might want to just say, okay, I'm going to put my phone on flight mode after 10 o'clock. I'm going to try and turn off the Wi-Fi at 10 o'clock. That's great for teenagers if you've got teenagers that are keeping you awake. Reducing the amount of input after a certain time so that you can sort of get ready and have that routine getting ready for bed. Also trying to wake up at a similar time each morning. And if you've had a terrible sleep, that's sometimes really difficult. But scheduling, we know. So you're messing as little as possible with that sleep-wake cycle. Alongside that, the recommendation is to really don't try and go to sleep until you feel sleepy. And so I guess there's a whole heap of strategies around, what can we do to help you feel sleepy at bedtime? Because it's all very well to say, well, I'm not sleepy, so I shouldn't go to sleep. But if it's 2 o'clock in the morning, then, that's really eating into sleep time. So I'll talk a bit more about some of those measures at the moment, in a minute, beg your pardon. If you're lying in bed and it's just not coming, it's just not there, then, give it 20 minutes. But then, look, maybe sometimes it can be actually better to get up, do something boring, do something calm, do something with low lighting and low kind of excitement factor, and just have a break. One of the things that can happen when we're not sleeping is that we can get anxious about not sleeping. And if one thing keeps you awake more than anything else, sometimes it's anxiety. So sometimes it's this snowball effect where you're not sleeping, you're feeling anxious because you're thinking, oh my goodness, my cancer cells are trying to just, put a up there, but get up, do something different. Maybe have a milky drink, just a little bit of a milky drink. That can really help. Maybe there's a fantastic podcast which I'll put in the notes. It's called Nothing Much Happens, and it's bedtime stories for grown-ups. It's as boring as insert the right word here. It's right. Nothing much happens, and that can be you don't engage with it, your brain doesn't engage with it, and sometimes just having a voice can be really helpful in just helping you sort of turn your brain off. I used to use ABC radio at night. There was a guy in Australian ABC radio called Tony Delroy, and he could seriously, within about 10 seconds, I would be, I think I had like a Pavlovian response. I think the new guy on ABC radio doesn't quite do it as well, but sometimes just listening to a really soft, restful radio, like a lot of radio stations, they're classic music or, whatever's going to really float your boat. Some people might find that classical music might actually ramp them up, so you've got to pick your style. But yeah, if you're in bed for 20 minutes and it's not coming to you, take a break, get up, have a little lap around your house if you can, listen to something boring, read a boring book, have the lights low so you're not waking yourself up, but then, wait till you feel sleepy and give it another go. Building some routine and some rituals around you going to bed. So that might be around turning off your devices, turning off your Wi-Fi. I grew up in a very firm home where no one went to bed unless they'd brushed their teeth and gone to the toilet. I nearly said brush the toilet and gone to the teeth, but it's the other way around. I can't sleep if I haven't cleaned my teeth, and even if I went to the loo like half an hour earlier, I've still got to go to the toilet before I go to bed. My husband laughs at me because that wasn't his routine. He just closes his eyes and goes to sleep. But, you might find that there's a routine that you go through. It might be, things like going around the house and locking all the doors and turning off all the lights. It might be, a regular piece of music that you listen to. It might be, having a warm milky drink or a bath or a shower, which can be really relaxing and helpful. One of the other tips is around the use of your bed. So the recommendation, and please know that I don't really take this advice, but if you're having trouble, it's worth thinking about this, that your bed should be used for sleep and for sex. So if you're tempted to lie in bed and look at your phone, we know that the blue light from phones and devices can actually cause insomnia or make insomnia worse. If you have to look at your phone, you can also put a blue light filter on it. You can also get glasses that filter out that blue light. So that might be worth a try. I'm not saying don't use your phone. If that's actually relaxing to you and helpful, then, well, whatever's working. But building up some of those rituals around your bedtime routine can be really helpful. Keeping your bed as a quarantine zone for sleep and for sex. Actually, sex can be really good. If you're up for it, it can really actually help you feel quite nice and sleepy. So the other thing about your bed is check out your sleep environment. It's summertime in Australia at the moment, so having a lighter, like a cotton blanket rather than a doona might help. Or as we've been tempted to do in my household, maybe have 2 single doonas if you're going through a lot of hot flushes and you just want a doona cover rather than a doona in the cover. Then get 2 single doona covers. Even go to Savers and get them from the op shop or something, and just have 2 single bed covers rather than a large one that the other person's wrestling with or drowning in because you've sort of thrown it off. See if you can get your mattress working well for you. So sometimes people find that sorry, I've just got a very cheeky comment about sex in bed and whether maybe that was what the kitchen was for. So I am delighted to read that comment from someone, from this person in the Facebook group. So good on you. It's nice to see you looking cheeky. Where was I? You've completely thrown me. Anyway, I'm not going to mention your name. Your mattress. So you can get like pillow toppers for mattresses. Sometimes as if we've lost weight, all of the lumps and bumps on our bodies, the shoulders and the hips and the knees and things can feel much more bulky than they used to. So sometimes the mattress that was comfortable 10 years ago or even 5 years ago might not be comfortable. You can get quite cheap foam toppers for beds at places like Clark Rubber and fairly cheap shops, so you don't have to get top of the range deluxe things, but sometimes even just a foam eggshell mattress topper can be useful. Try and cut the light out of your bedroom if you can, especially in summer if you're going to bed and it's still light, or if you live on a street where there's street lighting. That can be so distracting and annoying if you're having trouble sleeping. Again, try and get a quiet environment. And that's, again, easier said than done sometimes, especially if you're living with a snorer. Now, I did want to, this is a bit of show and tell, and because I can't see my video, I'm not really sure how much of this you'll be able to see, but I did come across this really quite natty sleep headband, and if you do a Google search, there's heaps of them online. In fact, probably me mentioning this while Facebook's opening means that I'll get lots of ads for them. You can buy expensive ones that are a lot of money. This one actually was given to me by someone who hated it, so they said it was a really cheap one. What it does is it's like, I'm going to have to take off my glasses here. This is really getting quite weird, but it's like a sleep mask, but it's got some Velcro at the back. It's got 2 speakers that sit over my ears, and there's a little Bluetooth transmitter. So this little cable's just for charging it, but it's got a Bluetooth transmitter, which means that I can Nothing Ever Happens podcast, and it just helps me. I think it's because of it's quite soft, this one. It's quite sort of cushioned, and for me, the feeling of having something lovely and soft over my face, you don't have to wear it over your eyes, mind you. You can just wear it as a groovy Pat Cash looking headband. Sometimes having something sort of cocooning my ears, even if there is a little bit of background noise, and I'm a mother of teenagers, so that happens, but that can be quite helpful. My own little cozy space. So I've talked about sound, I've talked about light, I've talked about the mattress, devices, lights. Oh, yeah, so just bear in mind what you're putting into your body, and that's both in terms of food and also fluids. So we know that people with nets often will have a lot of trigger foods, and sometimes that can leave you really bloated. So if you're feeling like you're getting lots of gut symptoms, have a think about doing a food and symptom diary, and we can see if maybe there might be something, a lot of people actually, it's even things like nuts or Doritos, or, the food that you're eating can sometimes cause a lot of wind, and that can cause problems overnight with o'clock in the afternoon. Other people, it's, nothing after lunchtime that's caffeinated. So you've got to work out what works for you. Smoking is a really big one for making you feel quite wakeful. It's a non-stimulant. So if you're smoking, well, there's lots of reasons to stop, and you don't need a lecture from me about it. But if you can avoid using cigarettes leading up to bedtime, that can be really good, or much better. Alcohol is an interesting one because it's actually a way that a lot of people use to unwind and relax. But we know from studies that people, when we do big studies, people who drink before they go to bed actually sleep worse overall. So if you're having a tipple before bed and it's fine and it's good for you, it's working for you, then there's no need to, worry too much about that. But if you're not sleeping that well, maybe just have a look at your alcohol intake in the evening and maybe ease up a little bit. That might help. And I've talked about steroids, so I'm just going through my list. The other thing that we put in our bodies is medication. So I've talked about steroids, but pain medication can actually really affect the quality of your sleep as well. For me, I'd have a bit of a propensity to be a bit anxious, and so for me, if I'm on really strong pain medications, it makes me feel dopey, but then I start feeling anxious about what I'm missing. So if you're having side effects from your pain medication or any other medication that you feel are affecting your sleep, have a chat with your doctor. If your doctor's sort of, scraping the bottom of the barrel, then sometimes talking to a palliative care physician can be really useful. Like, we often think of palliative care being as just managing the pain, but it's actually managing all of the symptoms that are associated with your quality of life. So not sleeping, that's really major, and there may be alternatives in terms of your pain management that will help with that. But having said that, also having pain, sometimes we become more aware of pain that might have been in the background during the day. So, if you're on pain medications, make sure you're taking them enough in advance so that they're having a good effect for the time that you're wanting to be going to sleep. I've talked about food. Exercise is another one. So we know that when people are exercising, they'll usually sleep better. Now, it's exercise right before bed will probably make you feel a bit more hyped up, but exercise, during that day. And I know that that's tough, especially if you're not well. But, even just a short walk, that might be, getting some fresh air, getting some sunlight, bearing in mind it's Australian summer, so be careful of UV, but getting some sunlight on your skin, getting some fresh air, getting some exercise can actually really help. What else? I've talked about baths and showers. I've really skipped around. I think the lack of video in my face has sort of made me lose my place in my brain, so apologies for the constant looking down at my notes. There are some, so there's some complementary therapies that can be really useful for sleep quality. I did a video a couple of weeks ago on complementary therapy, so I'm not going to go into that in great detail. Fantastic book from the Cancer Council about complementary therapies. It goes over all of the evidence, but things like hypnotherapy or acupuncture, we know that these things can be really great with anxiety. It may well be worthwhile having a talk with one of those practitioners to see if they might be able to offer something in terms of your sleep quality. There's another a fantastic, there's lots of podcasts and things which I'll direct to, but there's a at-home yoga practice called Yoga with Adriene, which went very viral last year in 2020 when everyone was trying to work out how they were going to stay fit and exercise at home. There's a particular playlist which is actually yoga for sleep, and they've got ones that are only 6 minutes long. They've got ones that are designed to do in bed, right through to sort of 20-minute relaxation ones. So I'll make sure I put the link to that playlist in the notes as well. The other thing I would just say is that, often if you're having trouble sleeping, it can be really tempting just to reach for the temazepam if you've got it, or the sleep medications. Sometimes for some people, often they're great, and we do recommend that they're used in the shorter term. Always talk with your doctor about it. So I do hear occasionally from people where they've got people overseas who are sending them to them where there's less regulation about their pharmaceutical industry in that country. it wouldn't be a recommendation to do that, because if you're having trouble sleeping, we actually want to make sure that you're checked out medically, that there's not something else going on metabolically, that there's not other symptoms that we can be managing better. So medications are a bit more down the last resort end, but sometimes they are fabulous for people. So, definitely talk with your health professional about it. One little thing I would mention, and this is just because with anxiety, so sometimes they can have the opposite effect. And that's Phenergan. That's actually a night duty nurse's bit of a favourite, because you don't need a prescription for it. But both with the traditional sleeping medications like temazepam or the other benzodiazepine drugs, but sometimes with Phenergan too, it can actually make you feel more hyped up. So it's worthwhile just going easy on them, and don't panic if they make you feel worse, but certainly don't persevere with them. Have another chat with your doctor about it. The other thing I would say is that, and I think this is coming back to what I was saying at the start, and that is that there is help available. So I've given you like an exhaustive list of things to try at home, and that I guess gives you some homework that you might get from a practitioner like a psychologist or an occupational therapist or a counsellor when we're talking about sleep. But if you've tried those things and you're still not getting any joy, absolutely talk to your doctor, but think about maybe getting, like if you haven't got one, get a mental health care plan and book in for some sessions with a psychologist. We know that cognitive behavioural therapy can be really effective for sleep disturbance. Talking with a counsellor can be really helpful just in terms of, processing some of that stuff that's difficult. And I guess, just as a final note, in terms of processing some of that stuff that's difficult, some of those other things that we know help, like, whether it's music, whether it's art, whether it's expressive writing, and sometimes it's like, blurting it all out on a page and then ripping it up and burning it in a safe way, or just destroy after you've written it all down, just to get it out of your head. Sometimes that can be really useful. For some people, journaling can be really great. And also, I think it can be really lovely to be reaching out for support. I guess, coming back to my early story about coming on in the morning and finding that someone's said, "Oh, is anyone else awake?" And usually there is someone else awake. So although I don't want you to be, I'm just making sure my computer's still on. It's obviously telling me I should stop. As much as we say don't use devices and trying to stay away from the blue light of the computer or the phone, hopping into an online community. Sometimes the overseas ones can be really good, because if no one's awake at Neuroendocrine Cancer Australia side of things, then probably over on Ronnie Allen or one of the other overseas communities, there will be lots of people who are up and about. So, just getting a bit of support and saying, look, am I the only one who's just not sleeping tonight? So, reach out to each other and make sure that you, asking for the support you need, and also extending the support to others. And I guess that was where I wanted to finish on today, which was around our community, our patient community. So if you're watching this via YouTube, this is probably a little bit less relevant for you, but I've just been super aware this last week or two that we've got some people who are doing it really tough. It seems to, sometimes it feels like it goes in cycles, where we just get a lot of people who get bad news in a row, and it's just, I know it's just so hard. I feel so encouraged when I see people talking about that, and the level of generous support, beautiful, warm support that comes in our group conversations. And so I just would encourage you to keep that up. I think it's really important, and we're all thinking of the people who are doing it tough in our community at the moment. And I'm not going to mention any names here, but there's some hard news for people this last couple of weeks. So we're thinking of you. There's probably not a lot that I want to say more, but only now just to mention that next week we've got our Melbourne and our Adelaide And our Brisbane support groups all meeting on Tuesday, so that's going to be a busy day in the Zoom room. And then I think the other thing that's happening that I just will let you know about is that there's a research collaboration group called Comnets, which is mostly between Australia and New Zealand and Canada. So there's some research meetings happening over the next couple of weeks. We've got some members of our consumer advisory group who are coming along as consumers the future research around cognitive changes and nets. So I'm very excited that I've registered for that workshop, and I'm looking forward to telling you, more when I can about what that research is going to look like. So I think I'm going to leave it there for the time being. And thank you very much to everyone who joined me. And it sounds like the screen or the feeds at least still work, so that's excellent. And so take care over the next week, and I'll look forward to talking with you next week. I don't have a topic yet. I would love to say it's going to be COVID and vaccines, but we're just going to have to watch this space. Some of the upcoming topics are, I have got a speaker, haven't got a date yet, but I've got a speaker to talk about advanced care planning, so I'm looking forward to taking a bit of a deep dive into that very soon. We're hoping to have an oncologist talk about highlights from the ENETS conference, which is coming up, and heaps of other really interesting topics. So keep the ideas coming. It's this sort of feedback, and it's the conversations in our Facebook group and on our Zoom support. Wondering about it too, so I just encourage you to feed the ideas to me. So my contact details will be in the notes, and it's been lovely to join you. I'm going to stop rambling on and leave you all to the rest of your Friday afternoon. Take care, everybody.